Now we start scanning from epigastrium by using convex probe and placing in transverse position. Here we see the left lobe of liver. The liver shows heterogeneous texture. When we tilting the probe towards right hypochondrium, here we see the dilated biliary channels. Now we will scan the pancreas. This is aorta. This is splenic vein and this is portosplenic confluence. The pancreas is lies above the splenic vein, so it is easy to locate. And first you find out the splenic vein and portosplenic confluence. The pancreas is normal in size and shows normal homogeneous texture. This is body of pancreas and this is tail of pancreas. Now, when we focus in the pancreas, we see that the pancreatic duct is visualized and dilated. Now we will find out the cause of dilatation of pancreatic duct, whether there is obstruction or any mass in the pancreas or in the common bile duct. Here we see the uncinate process head and neck of pancreas, which is normal. No mass lesion seen. Here we see a cystic area at the head of pancreas. This is common bile duct, which is also dilated. It means there is obstruction in the common bile duct. So there is also need to scan the common bile duct. Now we will measure the diameter of pancreatic duct. The diameter of pancreatic duct is 3.3 millimeter, but the normal diameter of pancreatic duct is up to 2 millimeter. Here we see the gallbladder. The gallbladder is full and contain multiple calculi. The wall of gallbladder is appear to be normal. Now we will measure the collectively size of these stones. And we will also measure the thickness of gallbladder wall. The collectively size of calculi are 21.5 millimeter and the gallbladder wall thickness is 2.8 millimeter, which is normal. The normal wall thickness of gallbladder wall is up to 3 millimeter. Now we will scan the common bile duct. Here we see the common bile duct, which is dilated, and this is portal vein, which appears to be normal in size. Now we will measure the diameter of common bile duct. The common bile duct diameter is 18.3 millimeter, but the normal diameter is up to 6 to 8 millimeter. Now we will scan the common bile duct to rule out cause of dilatation, whether it is due to calculus or mass. Here we see the gas shadow which obscuring the common bile duct, but slightly compressing the probe, the gas shadows are subside. Here we see a calculus in the common bile duct which cause obstruction. Now we will measure the size of this stone. The size of calculus is 14.7 millimeter, which causing partial obstruction as patient had no jaundice and biliary channels are also mildly dilated. Now how we will write report.